Hi everyone. In today's clip, I want to talk a bit about fatty liver. Please note that anything I record here are for informational use only and is not intended to diagnose or cure any ailments. So fatty liver happens when fat droplets accumulate in the liver cells that can lead to liver damage. If the fatty liver is caused because of excessive alcohol consumption, then this is called alcoholic fatty liver disease, and otherwise is called non-alcoholic fatty liver disease. Normal liver contains very little fat, some less than 5% of its weight. Liver is one of the heavier organs in the body, weighing about 1.5 kilogram, and it's located on the upper right side of the abdomen. Blood flows to the liver from two different sources. We have hepatic artery, which accounts for 20 to 30% of the blood supply, and we have portal vein, which is about 70 to 80% of the blood supply, and blood flows out of it through hepatic vein. The hepatic vein brings in blood from a variety of organs, including intestines and pancreas, and that is how excess nutrients get stored in the liver, like glucose, for example. This is a vital organ and has some 500 plus different functions that it performs in the body, some of which are like detoxification, protein and cholesterol production, glucose metabolism, vitamin storage, bile production, immune function, and a whole lot more. So fatty liver is the first stage of a liver disease. If it progresses, then the patient will have to deal with liver fibrosis because of long-lasting inflammation that has been there. If the fibrosis is not dealt with, then it will progress into cirrhosis of the liver, which will cause major damage to the organ and increases the risk of developing cancer. Now, if the scarring that happens in the liver because of cirrhosis is to the point that the liver cannot function anymore, then this is called liver failure, and the patient may end up doing a liver transplant. Non-alcoholic fatty liver disease could happen also due to use of drugs, and the leading role in developing this ailment is played by insulin resistance and hormone dysregulation, as well as unhealthy diet, sweetened drinks, infectious disease like hepatitis C and D, diabetes, protein malnutrition, chemical substances, medications, antibiotics, prolonged large doses of vitamin A, etc. So alcoholic fatty liver disease usually doesn't show any symptoms, does not cause any symptoms until the disease is severely advanced. Some of the symptoms can be fatigue, weakness, generally not feeling well, abdominal pain or fullness in the upper right side of the abdomen, loss of appetite, yellowing color of the skin or the white of the eyes, swelling in the hands and feet, swollen belly, red palms, mental confusion, and so on. Of course, the very first line of treatment is the change of diet. Vitamin E also has shown to improve liver health, as well as brewed coffee has shown to slow down scarring, and they believe that it has active enzymes to detoxify the liver and lower inflammation. Fatty liver disease, or FLD for short, can definitely be reversed. The liver is one of the few organs in the body that can replace damaged tissue with new cells rather than with scar tissue. So skip alcohol, ensure your cholesterol levels is under control, increase fiber consumption, avoid raw or uncooked shellfish, drink water containing chlorophyll drops, which will oxygenate the body and clear the liver as well. Milk thistle, vitamin E, essential fatty acids, curcumin, resveratrol, these are all healing to the liver. One method that I have used successfully is the following liver cleanse recipe from Barbara O'Neill. So day 1, you take 1 cup of fresh squeezed orange and lemon juice mixture. with 1 cup of water. We mix it with 1 cup of water, 1 clove of garlic, 1 tablespoon of olive oil, and half a teaspoon of chopped ginger, right? And you drink this up. Day 2, you follow the same recipe, but you double the garlic and the oil. Day 3, you do the same recipe with triple the garlic and the oil. Day 4, you follow the day 3 recipe. Day 5, you follow the day 2 recipe. Day 6 and 7, you follow the day 1 recipe. This is done first thing in the morning when you get up on empty stomach. And after drinking this, you wait for 20 minutes and then drink the liver cleanse tea. Now, let me show you how the liver cleanse tea is done. The recipe for the tea is depending on if you're using dry herb or the powder. When I say 1 part in the recipe, I mean 1 part equals 1/4 cup when it's in the herb form, or 2 tablespoons in the powder form. So then you take 1 part of dandelion root, 1 part of milk thistle, 1 part of dried gentian, 1 part of licorice root, and half a part golden seal, and 1 part ginger. Now, how to use this? Once you mix all this, you take 1 tablespoon of this mixture, 1 teaspoon of this mixture for every 2 cups of water. So you take 1 teaspoon of this mixture for every 2 cups of water. Use stainless steel pot, cover it, and wait until it simmers or slow boils. Lower the heat and maintain a simmer for about 15 minutes. Then cool it as much as you can and drink. You can soak the ingredients in cold water actually overnight if you want for better results. Do this for 7 days. Do this whole recipe for 7 days. Rest 1 week and repeat it for another 7 days. This has been very actually helpful. Coffee enemas are also very effective in liver cleanse. I have the recipe in my previous clip for you to refer to if you wish. Metaphysically speaking, liver relates to cleansing negative emotions and energies, as well as it is the center for vitality, courage, and life force. Anger and frustration take their toll on liver. So unresolved anger, chronic stress, pressed emotions, persistent frustration, emotional trauma, unfulfilled desires, all have huge impact on this vital organ. It's absolutely necessary to do an emotional and spiritual cleanse alongside the physical to take the body back to its normal state. To cleanse emotions, there are many methods available, and for a spiritual cleanse, meditation, quantum touch, energy healing, to clear the blockages for a smooth flow of energy are effective methods. So there are basically 4 steps to follow to bring the original glow back to the liver: dietary changes, herbal remedies, energy work, and emotional release, which, to be honest, is the recipe for all other ailments as well. Hope this introduction has been helpful. Please make sure to consult your healthcare provider before taking any health matters into your own hands. Like and follow for more. Be the light.